Today, we're diving into the devastating impacts of drug trafficking on public health, criminal activity, and the economy. This issue is not just a distant concern, it's a national emergency that affects every corner of our society. This isn't some abstract problem confined to dark alleys, it's a pervasive crisis that infiltrates our daily lives. It's happening in your town, on your street, and in your community parks where families gather, maybe even to someone you know, a friend, a neighbor, or a family member. Drug trafficking, particularly opioids, has burrowed into the fabric of this country, creating a web of addiction and crime. It leaves a trail of shattered lives and strained systems, from overwhelmed emergency rooms to grieving families. The ripple effects touch every aspect of our society, demanding urgent attention and action. When we talk about the opioid crisis, we often focus on the devastating impact it has on individuals and families. But there's a larger, more sinister force at play. We can't ignore the cartel in the room. These powerful and ruthless organizations operate with near impunity, driven by immense profits. They are the primary suppliers of illicit substances like fentanyl, methamphetamine, cocaine, and heroin to the US market. Their reach is vast, and their methods are sophisticated. Smuggling these dangerous drugs across the border, they evade law enforcement with cunning tactics and sheer audacity. Once in the US, they cut their product with whatever they can get their hands on. Rat poison, fentanyl, you name it. This makes the drugs even more dangerous and unpredictable. This potent cocktail floods our communities, infiltrating every corner of society. From urban centers to rural towns, no place is immune. Making highly addictive substances cheap and readily available, they target the most vulnerable among us, including young people and those already struggling with addiction. The consequences are dire: increased addiction rates, skyrocketing crime, and communities in turmoil. A generation caught in a vicious cycle of dependence and despair, seeking a way out but often finding none. The fight against this epidemic is ongoing, and the stakes have never been higher. Let's talk about fentanyl, a substance so potent that just a few grains can be lethal. Imagine something so small yet so deadly that it can end a life in mere moments. This synthetic opioid, trafficked by cartels, has fundamentally changed the opioid crisis. It's not just another drug. It's a game changer, a silent assassin that has infiltrated communities across the globe. Fentanyl is being laced into everything from heroin and cocaine to counterfeit prescription pills, making it nearly impossible for users to know what they're ingesting. This turns casual use into a deadly game of Russian roulette. One wrong move, one bad batch, and it could be the end. Over 70,000 deaths are reported annually from opioids, with fentanyl playing a starring role. These aren't just numbers, they are lives cut short, families torn apart. Emergency responders are overwhelmed, communities are in mourning, and the crisis shows no signs of slowing down. We are losing an entire generation to this silent killer, a generation that could have been our future doctors, teachers, and leaders. It's time we start treating it like the national emergency it is. We need more awareness, more resources, and more action to combat this epidemic. The clock is ticking and lives are at stake. The opioid epidemic is putting an unbearable strain on our already overburdened healthcare system. Emergency rooms are overflowing with overdose patients and resources are stretched thin. The long-term effects of opioid addiction are pushing healthcare providers to their limit. Rehabilitation centers are bursting at the seams with long waiting lists. The cost of treating addiction is astronomical, draining billions from our economy. Ignoring the problem won't make it go away. The opioid crisis is a complex issue with no easy solutions. We need to treat addiction as a public health crisis, invest in prevention, treatment, and recovery programs, and hold traffickers accountable. Most importantly, we need to start talking about it openly and honestly. Stay informed, stay safe.